As parents and educators and service providers in the room here, we all aspire to help young people with disabilities live the lives of their dreams, right? We want them to work, we want them to be part of community, we want them to try things, to learn, and to grow. As we've discussed over the last two sessions, learning and growing does sometimes create challenges. It can cause stress, and we can sometimes face risks as we learn and grow. In my work around the state, I regularly meet families and service providers and educators that wonder whether or not it's possible for youth with the most significant disabilities to work. And I can, with confidence tell families and educators and service professionals around the state that I've seen it happen over and over and over. So if someone can't use words to communicate or they have limited skills and they have, lots of needs for support, they can work. Yes, absolutely. I believe firmly that everyone who wants to work can work, and we can figure that out. Will it take more time? Yes. Will it require more of our creativity and our energy? Yes. But we will eventually get there. Okay. There is a payoff for helping people and investing on the front end to, in transition to help people pursue employment. There's lots and lots of research that tells us that people with and without disabilities, no matter what the disability, are happier and healthier if they're working. Okay? And so that has personal payoff as well as public payoff. Okay? Publicly funded systems benefit by investing in employment, because they benefit. There is a return on that investment. Okay. I like this quote here that's on the slide. It says, "Every single person in this country has skills and talents to contribute to the workplace, and every single person has an inherent right to work." Very powerful statement. Was said by Neil Romano, who is now a former Assistant Secretary to the Department of Labor's Office of Independence and Employment Policy. So as parents and as educators and service providers, you can help youth with significant disabilities dream big when it comes to employment, because here in Wisconsin, we're really fortunate to have systems that support employment for people with disabilities. Not all states have that. We are very fortunate here in Wisconsin to have very innovative state agencies that are willing to come together to make employment happen for all people with disabilities. So one thing that you'll hear me talk about, maybe use the terminology of integrated employment, and I want to make clear that when I talk about employment, I'm making reference to integrated employment, unless I otherwise note, if it's a different kind of employment. So in the first night, Liz had, kind of given us a little bit of a definition around that. There's kind of two distinct ways that people work. It's either in the community or in segregated settings, right? And so integrated employment refers to working in a regular job in the community for a regular wage, okay, around people with and without disabilities. Integrated. So before we dive too deep into the evening, let's step back and take a look at where we're at in Wisconsin right now with youth with disabilities as it pertains to employment. So each state partner collects data on employment rates for youth. Okay? In 2010, 80% of the youth who responded to the Department of Public Instruction's post-high school outcomes survey were employed in the year following graduation. Of that 80%, 95% were working in community-based settings. 4% supported employment, 6% self-employment or working in a family business, and 2% reported to be in sheltered employment arrangements. On the DVR side, the Division of Vocational Rehabilitation side of things, there were 4,712 transition-aged youth who applied for DVR services in fiscal year 2011. DVR's rehabilitation rate is 61%. So the rehabilitation rate is the percentage of DVR consumers that are closed successfully after a plan has been developed and implemented with them. Now let's take a look at what's happening with youth involved in the long-term care system. So these are youth with the most significant disabilities. These are youth that probably represent our sons and daughters and the people that we're working with in school or as service providers. So the following graph reports on the number of transition-aged youth, 18 to 24, who received an adult long-term care functional screen or a mental health status report in the fiscal year 2011. Of those transition-aged youth with an adult long-term care functional screen, the graph also reports the number of transition-aged youth with developmental disabilities, physical disabilities, and co-occurring severe mental illness. Both the adult long-term care functional screen and mental health status report capture the number of individuals who have integrated community or home-based employment. As you can see here on the graph, 15% of transition-aged youth with developmental disabilities are working in integrated settings. 7% of youth with physical disabilities are employed. The numbers are considerably higher, though, if you look at youth with mental health disability only, about 27%. So unfortunately, most people served by the long-term care programs in Wisconsin are spending their days in day centers or sheltered work centers or at home, unemployed. That's how it goes. Many of them have dreams of working in the community for some part of the day or for all of the day or some part of the week or all of the week. So why hasn't this happened? Sometimes it's systemic. Sometimes it comes down to personal values and beliefs. Sometimes it's a resource issue at the local level. But it is possible to improve the numbers. Not impossible. There are states all over the nation that have excellent numbers when it comes to people with disabilities and integrated employment. They've implemented strategic, activities to increase the numbers and changing their systems and to support people towards employment. Washington State, for instance, has somewhere, I think, over 70% of people with developmental disabilities that are working aged in integrated employment. So services have evolved in Wisconsin to support employment. We know that. Okay? Like I said, we have these very strong and innovative state partners that we'll hear from later that support employment. Our communities and our practices have to catch up a little bit. Okay? And that's normal. That's a normal part of systems change. Prior to the 1960s, it was common for people to live in institutions and attend special schools, right? Then, in the late 70s, 80s, we started moving people into group homes, right, and opening day centers and work centers for people to work. Then we started moving into the realm of supported employment in the 80s. And the foundation of supported employment is that people are ready to work now. If people want to work, they're ready to work now with the right supports, okay? And that we don't have to learn skills in one setting in order to be ready to work in the community. So in Wisconsin, we had pockets in the state that did a really great job of supported employment. And then we had other parts of the state that not so much, okay? Some of this comes down to waiting lists and scarcity of services. For decades, for instance, in Wisconsin, there were counties that had long waiting lists, probably a lifetime for some people, to access long-term care services, okay? And without long-term support, DVR couldn't do their part in helping people, attach to employment, okay? So those two partners couldn't work together around people with the most significant needs oftentimes, because DVR has a mandate to look for long-term support for people, and for people who need some formal paid support, that support wasn't always there, okay? And so then what did that do for schools, right? Schools didn't want to send kids, get kids ready in the school setting or, in community just to go to graduate to nothing, to no support to, continue to live those dreams, right? So we were kind of stuck because we didn't have these systems lined up and able to work with youth with significant disabilities. Okay. But now that's changed. Now we have things called a couple of different long-term care options called Family Care and IRIS that some of you have heard about. And most counties that are involved in this training have Family Care and IRIS in their counties. And what that means is that people have access to services that they need, including employment services. Okay, so if someone needs to have employment supports over the long term to be successful with employment, they can access those through these new programs. Okay. So for the very first time, actually, since 2007, when those long-term care programs started to expand across Wisconsin, the very first time many communities actually had this, finally, this lining up of service systems that could support youth with the most significant disabilities into employment. Okay, so this is relatively new. I mean, some counties, we're talking just a couple of years, are just waking up to the idea that, wow, supports are there. And so what does that mean for our schools? What does that mean for our, as parents, we can dream differently. We can help our sons and daughters dream differently. We have to do some things differently in school in order to help youth, pursue that path to employment. The availability of those services isn't enough. Okay, services never do the job, right? They help, but they don't do the job. So effective partnerships with families is really, between families and service providers and schools, particularly with youth in transition, are really what the key ingredient is to success. In transition, a strong partnership is necessary. Schools can do their part by arranging, community-based or school-based work experiences, okay, and helping someone learn about what they want to do and what their skills are. But families also play a role in doing that with youth with disabilities, right? Or with all of their sons and daughters. They play that role in helping their sons and daughters think about what lies ahead, and they help them develop skills and connections outside of the school day. So parents are also instrumental in helping their sons and daughters find their very first job. How many of you found your very first job, or first few jobs, or even the job you have right now, through someone you knew, through a family member? Okay. Sometimes it's starting to help Uncle Joe do his, in his plumbing business is where you get your very first job or something. Cleaning the bathroom at the shop or something. But families are a critical piece in getting that very first job.